One of the most common complaints you'll hear patients say when their blood pressure is high, I have a white coat syndrome. The problem is that a lot of times that assumption is wrong. Your NP pal here, and welcome to another lesson from the tracks. All right, so I titled today's segment, it's not white coat, it's high blood pressure. So I know that y'all know. We see this every single shift. Okay, somebody will come in there for sore throat, they're sick, orthopedic injury, and incidentally, we'll see that the blood pressure is elevated. And being busy in an urgent care, even in ER, is something that we typically address. But for myself, most of my career has been in the ER, so I'm used to crazy high numbers, 160, 170, 80, 200. So for a while, certain numbers didn't even excite me. 140, 150, I'm like, yeah, that's nothing. But, in the outpatient setting, especially urgent care, that is definitely something that you should not just ignore, okay? And so, as we know, back in the day, decades ago, the range was, 120 over 80 to 140 over 90. That was still, kind of in the safe range. As we know, that now 130 over 80 is stage 1 hypertension. And that means the threshold is lower. They should be in the 120s or 110s. So even in the 130s is high. Like just last week, I had a patient that was there for something and their pressure was like 137 over 84. And it was red. So like the system had flagged that it's elevated. And so it's something that is more common now. And while yes, part of that is true, the whole anxiety, if they're not feeling well, they're in pain, they're stressed, just being in the setting, that can increase the blood pressure, which we all know that. So for this particular topic, there's not a lot of evidence that just clearly states, yes, this is what it is. But what I did find was any blood pressure with some anxiety, for systolic, it said anywhere between like 5 and 15 points, okay? Now this is not across the board. So an anxiety blood pressure, 140 over 50, okay, right? Especially look at the actual patient at that time frame, okay? Because we know it can fluctuate depending on how they feel, depending on what's going on. Now, if their blood pressure is high and they're in there for an injury and their pain is 10 out of 10, okay, right? If the story matches the blood pressure, I typically don't get worried. I'm talking about the person that is calm, that is walking in there for something completely different. They don't have a fever. Not that they feel fine, but they're in there for some other reason and they don't have anything that can really make it elevated, okay? Those are the ones that I'm talking about, which is still fairly common. I mean, I at least see two or three of these patients per shift, okay? And I'm not exaggerating. And I know you understand too, because it's such a common problem. And I put in a lot of time. I do about probably 180, 200 hours per month, and I've been doing that for years. So I've seen a lot of patients, okay? All right, so what brought this up was that, yes, it's common. Yes, the stress can happen, but it is a convenient excuse. That is the first thing patients say. Oh yeah, I have a white coat. And then they just keep going, right? So a very common scenario is, let's say they're in there for sore throat, no fever, nothing like that. Strep is negative, and you just so happen, hey, I know you're here for sore throat, but your blood pressure is elevated. And they're on the phone. Yeah, they always tell me that when I go to the doctor. Okay, so do you check it like outside of here? No. Okay. So have you had this checked anywhere else? You have a primary doctor? Oh no, it just happens when I'm at the doctor. Okay, so as providers, we know that the guidelines say 2 abnormal blood pressures on 2 separate occasions. You can technically diagnose them with it. Now, the difficult part is that in urgent care, we don't typically do primary care depending on the situation. Now, I've worked in a private practice and I work for like a large organization. So things operate a little bit differently. At the private practice, the doctor actually did kind of want us to start doing some primary care for certain conditions if we felt comfortable. So there are situations where you can kind of be their PCP in that setting, depending on the situation, usually like a full-time place. But this current place I'm at, it's a larger organization, and we were actually just having this discussion not too long ago. So they have like a new policy where it's like, we should be paying more attention to these cases, and just not necessarily that you have to treat or diagnose, but just make mention and then document, okay? So instead of, trying to diagnose someone, just have the brief conversation. Hey, your blood pressure is elevated. We can recheck and see what it is, but it's not, it could be dangerous just walking around in this. And that's even somebody 140, 150. So they just want you to kind of have a conversation. And it's a very common issue now that people don't have a PCP. So that's another thing. So these people are just kind of passing through us just untreated. And again, the white coat is something that they say. We typically don't put that on them. They give that to us. And so the thing is, I've had a lot of patients that they get very defensive. It's like they get upset that you even bringing it up or even saying something about it. And it's like, well, ma'am, I'm just telling you what I'm looking at right now. Like, I remember my first job many years ago, and I still remember the lady sitting there in the corner. She was on her phone, and I was talking to her about it. And I was just like, well, your blood pressure is really high right now. It's like 159 over 90 or something like that. And that place I worked had been around for like 10 years. And they were like kind of the neighborhood urgent care. So a lot of people were going there on a regular basis. But the good thing is that in the trends, I had like years of data. And I remember pulling hers up because hers went back like 8 years. And literally every visit, her pressure was high. She had a lot of them. So there is no question that lady had hypertension. It's just, trying to convince her. But again, in urgent care, you don't have a lot of time to sit there, especially if they're not even in there for that reason and they're asymptomatic. They don't have a headache, not chest pain, no shortness of breath, not dizzy, anything like that. So I want to encourage you to just do your due diligence and not just accept that convenient excuse, because again, they will explain away. Oh, I've been stressed out. Oh, I just got off work. Oh, I had a heartache. You hear it every single day, right? So it's not to even try to persuade them. It's just have the conversation. You should have this rechecked in about a week or so. If you don't have a machine, maybe it's something you want to pay attention to. I know that you feel fine, but they do call hypertension the silent killer for a reason. So just kind of give them those little facts, which can usually take less than a minute, okay? And then document the code, elevated blood pressure without the diagnosis of hypertension. Document that you talk to them, and that's it. That's really all you have to do. And it's a good thing for the patients, okay? So another thing that I do now is I'll either put in a referral if they don't have a PCP, or I'll give them a list of some providers that they can follow up with. So that's kind of the thing there. It's just, people just accept that answer and they just explain away, and it's just like, okay, fine. But there's so many people that are walking around, more people are unhealthy now. And so, they have higher incidences of obesity, hypertension, diabetes, and things like that. And they always have a reason as to why. Or they'll just, oh, it's borderline. Oh, my doctor's watching it. Or there's always something. But just do due diligence, okay? Just explain. Let them know, hey, your blood pressure is high. You should get this rechecked in a couple weeks, okay? That's it. Document, and that way you are not just letting these patients walk out, okay? All right, your MP Pal here. Practice boldly, and I will see you on the next one.